Hello everyone. Today we will explore safe blood collection from donors, a core task in hematology and blood bank practice. This procedure is more than routine. Errors can cause serious harm to donors and recipients, so precision and care are essential. We will describe the process step by step: pre-donation counseling and screening, venipuncture preparation, collection technique, and post-collection safety. Follow a systematic approach. Consistency prevents errors and supports safe transfusion outcomes for everyone involved. Throughout this guide, we highlight labeled diagrams of the venipuncture process and concise on-screen safety captions for quick reference. Let us begin with the first phase, pre-donation steps, which start before the needle ever touches the donor. Pre-donation steps begin with clear information and counseling. Explain rights, procedure, tests, and what the donor should expect. Provide information either verbally or in writing. Ensure the donor understands the steps and any tests that will be performed on their blood. Obtain informed consent. This is an ethical requirement and must be documented before proceeding with collection. Conduct donor screening and a targeted medical history to identify risk factors, recent travel, medications, or health conditions. Check vital signs and hemoglobin. Use established acceptance criteria and document any findings that affect eligibility. A labeled flowchart summarizes screening and consent steps to ensure no required step is missed before collection begins. Prepare the collection area and equipment. Confirm supplies, needles, collection tubes, tourniquet, antiseptic swabs, gloves, and sharps container. Practice hand hygiene and wear appropriate personal protective equipment before touching supplies or the donor. Verify donor identity at the bedside and confirm the procedure once again, matching labels to the donor before collection. Position the donor comfortably with the arm supported. Select the most appropriate vein, usually antecubital, by palpitation. Apply the tourniquet correctly to aid vein visibility, avoiding excessive tightness and limiting application time to recommended standards. Perform skin antisepsis using an approved antiseptic and allow the site to air dry fully. Do not touch the site after cleaning. Use a smooth, confident motion to insert the needle with the bevel up at the appropriate shallow angle for venipuncture. Confirm blood flashback, then proceed to collect required volumes into labeled tubes in the correct order of draw. Invert tubes gently as required to mix additives. Do not shake vigorously, which can hemolyze samples and affect test results. Continuously monitor the donor for signs of discomfort, lightheadedness, or adverse reactions throughout collection. If complications occur, stop collection, keep the needle in place if hematoma is developing, or remove and apply immediate pressure as appropriate. After collecting the required samples, remove the needle smoothly, apply direct pressure until bleeding stops, and then bandage the site. Label all tubes immediately at the bedside with donor identifiers to maintain sample integrity and prevent misidentification. Observe donors post-donation for a recommended period. Provide fluids and clear aftercare instructions about rest and activity restrictions. Dispose of sharps immediately in an approved container and follow institutional protocols for biohazard waste handling. Complete documentation, attach test requisitions, and prepare samples for safe transport to the laboratory following chain of custody protocols. Emphasize quality assurance, ongoing staff training, and prompt incident reporting to continuously improve safety and outcomes. In summary, safe blood collection requires informed consent, meticulous preparation, correct technique, vigilant monitoring, and strict post-collection procedures. And that wraps up today's topic. If this explanation helped you understand the concept more clearly, make sure to like the video and subscribe to this channel for more simplified lab technology and radiology lessons powered by AI. We break down complex subjects in hematology, biochemistry, microbiology, pathology, X-ray, MRI, and diagnostic imaging, step by step, so you don't just memorize, you truly understand. If you have any questions or want a specific topic covered, drop it in the comments below. Until the next video, keep learning smart, keep thinking critically, and keep mastering diagnostics.